Constipation in children. If your child is experiencing constipation, with or without additional symptoms, this episode will help you determine what the issue is. Constipation in infants and children occurs when they have hard stools or have problems passing stools. A child may have pain while passing stools or may be unable to have a bowel movement after straining or pushing. Considerations. Constipation is common in children. However, normal bowel movements are different for each child. In the first month, infants tend to have bowel movements about once a day. After that, babies can go a few days or even a week between bowel movements. It's also difficult to pass stools because their abdominal muscles are weak. So babies tend to strain, cry, and get red in the face when they have a bowel movement. This does not mean they are constipated. If bowel movements are soft, then there is likely no problem. Signs of constipation in infants and children may include: in infants, being very fussy and spitting up more often. Difficulty passing stools or seeming uncomfortable. Hard dry stools. Pain when having a bowel movement. Belly pain and bloating. Large wide stools. Blood on the stool or on toilet paper. Traces of liquid or stool in a child's underwear. This is a sign of fecal impaction. In children, having less than 3 bowel movements a week. And moving their body in different positions or clenching their buttocks. Make sure your infant or child has a problem before treating constipation. Some children do not have a bowel movement every day. Also, some healthy children always have very soft stools. And other children have firm stools, but are able to pass them without problems. In this episode, we will now discuss each of the primary conditions and diseases that can cause constipation in your child. The conditions and diseases include: intestinal obstruction, anal fissure, encopresis, and intussusception. Constipation is common to each of these diseases and conditions. Several are medical emergencies. For each disease or condition, we will provide a brief description and other symptoms specific to the disease or condition. Please listen to each to find the cause of your child's constipation. Links are provided below for episodes that cover causes, diagnosis, and treatment. Intestinal obstruction. An intestinal obstruction could be a medical emergency. An intestinal obstruction occurs when food or stool cannot move through the intestines. The obstruction can be complete or partial. There are many causes. The most common are adhesions, hernias, cancers, and certain medicines. Symptoms include: severe abdominal pain or cramping, vomiting, bloating, loud bowel sounds, swelling of the abdomen, inability to pass gas, and constipation. An intestinal obstruction could be a medical emergency. A complete intestinal obstruction often requires surgery. Causes. The most common causes of intestinal obstruction in adults are: intestinal adhesions, which are bands of fibrous tissue in the abdominal cavity that can form after abdominal or pelvic surgery. Hernias, which are portions of intestine that protrude into another part of your body. Colon cancer. And intussusception. In children, the most common cause of intestinal obstruction is telescoping of the intestine, called intussusception. An anal fissure can be seen as a crack in the anal skin when the area is stretched slightly. The fissure is almost always in the middle. Anal fissures may cause painful bowel movements and bleeding. There may be blood on the outside of the stool or on the toilet paper or baby wipes after a bowel movement. Symptoms may begin suddenly or develop slowly over time. Causes. Anal fissures are very common in infants, but they may occur at any age. In adults, fissures may be caused by passing large, hard stools or having diarrhea for a long time. Other factors may include: decreased blood flow to the area, and too much tension in the sphincter muscles that control the anus. The condition affects males and females equally. Anal fissures are also common in women after childbirth and in people with Crohn's disease. Fecal incontinence. Fecal incontinence is also known as encopresis. If your child has fecal or bowel incontinence, you need to see a doctor to determine the cause and treatment. Fecal incontinence can occur in children because of a birth defect or disease, but in most cases it's because of chronic constipation. Potty-trained children often get constipated simply because they refuse to go to the bathroom. The problem might stem from embarrassment over using a public toilet or unwillingness to stop playing and go to the bathroom. But if the child continues to hold and stool, the feces will accumulate and harden in the rectum. The child might have a stomachache and not eat much, despite being hungry. And when he or she eventually does pass the stool, it can be painful, which can lead to fear of having a bowel movement. A child who is constipated may soil his or her underpants. Soiling happens when liquid stool from farther up in the bowel seeps past the hard stool in the rectum and leaks out. Soiling is a sign of fecal incontinence. Try to remember that your child did not do this on purpose. He or she cannot control the liquid stool and may not even know it has passed. Why children get constipated? They were potty trained too early. They refuse to have a bowel movement. This can be because of painful ones in the past, embarrassment, stubbornness, or even a dislike of public bathrooms. They are in an unfamiliar place. They are reacting to family stress, like a new sibling or their parents' divorce. And they can't get to a bathroom when they need to go, so they hold it. As the rectum fills with stool, the child may lose the urge to go and become constipated as the stool dries and hardens. Some warning signs to watch for include: pain with bowel movements, hard stool, constipation, refusal to go to the bathroom, soiled underpants, and signs of holding back a bowel movement, like squatting, crossing the legs, or rocking back and forth. Intussusception in children. Intussusception is the sliding of one part of the intestine into another. Symptoms. The first sign of intussusception is very often sudden, loud crying caused by abdominal pain. The pain is colicky and not continuous, but it comes back often. The pain will get stronger and last longer each time it returns. An infant with severe abdominal pain may draw the knees to the chest while crying. Other symptoms include bloody, mucus-like bowel movement, sometimes called a currant jelly stool, fever, shock. Shock symptoms include pale color, lethargy, and sweating, stool mixed with blood and mucus, and vomiting. Causes. Intussusception is caused by part of the intestine being pulled inward into itself. The pressure created by the walls of the intestine pressing together causes decreased blood flow, irritation, and swelling. Intussusception can block the passage of food through the intestine. If the blood supply is cut off, the segment of intestine pulled inside can die. Heavy bleeding may also occur. If a hole develops, infection, shock, and dehydration can take place very rapidly. The cause of intussusception is not known. Conditions that may lead to the problem include viral infection, enlarged lymph node in the intestine, and a polyp or tumor in the bowel. Intussusception can affect both children and adults. It is more common in boys. It usually affects children ages 5 months to 3 years. We hope you have found this information valuable. We have many other sessions on medical-related topics. If you need information on a particular topic, please leave a comment below. Please click the subscribe button and ring the bell.